Hello, everyone, and welcome back to the Renal Tracker Health Podcast. I'm Kirby, your host for today. If you or your loved one has been diagnosed with chronic kidney disease, you know that one of the biggest challenges is figuring out what to eat and what to avoid. The good news is, today's episode is your quick guide to practical CKD food swaps so you can keep your food flavorful without compromising your kidney health. To help us dive into this important topic, I'm joined by the wonderful Dr. Henry Manfield, a leading nephrologist who's helped hundreds of CKD patients transform their nutrition and their lives. Dr. Manfield, welcome to the podcast.
Thank you, Kirby. It's a pleasure to be here, and I'm excited to talk about simple strategies that can make a big difference for people with CKD.
Absolutely. So, Dr. Manfield, we often hear from our Renal Tracker community that the long list of do not eat foods can feel a little overwhelming, especially when juggling other conditions like diabetes or hypertension. Is it possible to manage CKD with easier, more enjoyable food swaps?
Yes, definitely. The key is not just about removing foods, but finding kidney-friendly alternatives that you'll actually enjoy. For instance, processed meats and salty snacks are high in sodium, which can increase blood pressure and cause fluid retention. But instead of just cutting them out, try swapping them for fresh, lean proteins like chicken or turkey, and use flavor boosters like garlic, lemon, or fresh herbs rather than salt.
That's so doable. And what about potassium? I've read that managing potassium can be tricky in stages 3 and 4 of CKD.
You're right, Kirby. High potassium can lead to heart problems, so it's important to be mindful. Instead of high potassium foods like bananas and potatoes, opt for apples, berries, or even white rice instead of brown rice. These small swaps help keep potassium in check without sacrificing variety.
Great tips. Now, phosphorus is another big one, right? Would you share an example of a smart phosphorus swap?
Of course. Many processed cheeses, certain meats, and nuts can be high in phosphorus, increasing the risk of bone disease and heart complications in CKD. Instead, reach for fresh fruits and vegetables. For example, crunchy carrot sticks or cucumber slices with a kidney-friendly dip are excellent alternatives to snacking on nuts.
Perfect. Now, you mentioned whole grains earlier. How do they fit into a CKD-friendly diet?
Whole grains like quinoa, barley, or whole wheat bread provide fiber and essential nutrients, helping with blood sugar control and overall health. Swap out white bread and pasta for these whole grain options when possible. Just be mindful of portion sizes and your individual dietary restrictions.
And last but not least, dairy can be a tough area for many CKD patients. What's your take on dairy swaps?
Many traditional dairy products are high in sodium and phosphorus. A simple swap is choosing almond milk or coconut yogurt, which provide that satisfying creaminess without overloading your kidneys.
It sounds like with these swaps, lean proteins, low potassium fruits, fresh veggies, whole grains, and dairy alternatives, patients can still enjoy delicious meals. Dr. Manfield, any final encouragement for listeners who are worried about making these changes?
Absolutely. Focus on progress, not perfection. Start with 1 or 2 swaps and build from there. Remember, these small changes can make a big difference to your kidney health and overall well-being.
Thank you so much, Dr. Manfield. And for everyone listening, if you want a handy list of the best foods for your kidneys, just click the first link in the comments. We've put together a kidney food list you can download and use right away. That's it for today's episode. Thank you for joining us, and be sure to tune in next time for more tips on thriving with CKD. Take care, and don't forget to check that link below.